The pandemic has pushed hospitals to quickly find new and better ways of treating the virus, and the survival rate has improved. Yet, leaders from all our local hospitals stress the ongoing, very serious threat here. Bill Folsom live in our continuing coverage, a perspective from the hospitals, and he's live outside UC Health Memorial. Bill.
Yeah, there is the current issue with rising numbers that could overwhelm our hospitals. Yesterday, we told you about the 70 cases that are being treated within our UC Health system. One day later, that number is now at 75, 20 higher than their peak back during the stay-at-home orders in the spring. The other issue is a lot of people underestimating the potential impact of COVID-19 if you get it. UC Health hospitals in our region facing a surge of COVID-19 patients.
If this number continues to grow, it's very hard to maintain current operations as you get more and more people in the hospital who are sicker and sicker.
Just weeks ago, Penrose Hospital reported manageable numbers. Now there's concern.
And now we're about 30% over that.
Children's Hospital Colorado Springs also with increased COVID cases.
Go up with the adult population as well.
Leaders of the major hospital systems in El Paso County joining the plea for everyone to do the small prevention measures that combined can slow the COVID spread. The hospitals treat this county and others that don't have as many medical options.
We've been particularly concerned about the rising numbers of people who are testing positive for coronavirus.
So it's not just right now, I get sick, they get me better, I get out of the hospital.
Cautions go beyond hospital capacity. Treatments have improved, but there is still a lot to learn about COVID-19. There is early evidence of long-term effects.
I get better maybe, or I may have a long-term effect that could affect my heart, could affect my lungs, could affect my ability to fight disease in the future.
As we progress through the pandemic, we potentially may be seeing long-term effects in our patient population.
The unknowns are why doctors at Children's say kids that have COVID should get a doctor's okay before returning to strenuous activity like sports. If they're older than 2, get them to wear a mask.
It's very important to keep your children masked and socially distanced during this time.
Children are less likely than adults to have severe complications, but it does happen. More than 2,000 kids in our area in El Paso County have tested positive for COVID-19. Watching out for you, El Paso County. Bill Folsom, News 5.